Hello there, this is Dr. Mintz. This is a CT abdomen and pelvis in a woman who is recently status post C-section. She is experiencing abdominal pain, nausea, and fever. I'll scroll through it to give you a chance to get an overview of what we have here. And then now that your interest has been piqued, we'll go back a little bit more slowly so you can analyze a little bit more what you're seeing here. Maybe form a conclusion. Okay, one thing that this examination shows us is the value of oral contrast. Now I will focus first on where we are seeing oral contrast. Here you see oral contrast in the stomach. It goes from the stomach into the duodenum. Then from the duodenum it goes into jejunum, and you can see some loops of jejunum here, which is proximal small bowel, here and here. In this area we seem to be in the more distal small bowel, which is ileum. It's jejunum proximally and then ileum distally. And I would say that the ileocecal valve looks like it's right here. And you have contrast in the terminal ileum, and you have oral contrast in the colon. And this is, once again, this is ileum. And this is right colon. Here we are at the terminal ileum, entering the at the ileocecal valve into the right colon. This is cecum here. And then as we go up more superiorly, this is right colon. Here we have transverse colon coursing over like that. And we follow that down now, and we see left colon, although it's hard to see that here. I think it's right in here, perhaps. Kind of lose it there. But if we go from the bottom up, let's see what we can find there. We have, here's the rectum. Follow that up. And this is coursing over this direction, so that would make this sigmoid colon, some sigmoid colon here. Okay, and then this is bridging across over here to that structure there, which we initially thought correctly was the left colon. Okay, so we have identified what is small bowel here and large bowel, and we see other structures. Clearly there are air-containing structures that have air fluid levels. Here's one here, here's one here, here's one here, and none of those are bowel. None of those are corresponding to the areas which we have just identified as being stomach, duodenum, small bowel, colon. So this is extraluminal fluid with air. This is extraluminal fluid with air. It's alongside the liver, along the convexity of the liver. Here's a portion of a fluid collection that is immediately adjacent to the inferior portion of the right lobe of the liver. This looks like it's the gallbladder. And then we have fluid overlying the, the dome of the liver, fluid right here, and air here, and that is air beneath the right hemidiaphragm. So this is some free air. It may be a loculated collection, but this is what we see when we see free air intraperitoneally that we identify as free air under the hemidiaphragm on an upright KUB or an upright abdomen. Here we're seeing fluid level within this area of the peritoneal cavity. So that's actually within the peritoneal cavity, but outside bowel. So what we have here then is a complication from the cesarean section. And here you can see this is the level where the transverse incision was made for the C-section. And you can see that below that, fat is nice and clean and undisturbed. Then we go through it, and then above that, the fat also has a good architecture and no linear opacities or areas of irregularity. So this is where the incision was made. And for some reason there was a complication, and we have then abscess cavities, fluid collections with air in multiple areas of the abdomen. Right here between the uterus, this is the uterus here, and the rectum back here, that would be a posterior cul-de-sac. So that's fluid in the posterior cul-de-sac that is suggestive of an abscess because there's an air fluid level there as well. So that all suspects an abscess cavity in the posterior cul-de-sac. This is a large collection here of fluid with air, also indicating an abscess cavity. Here's something that kind of has a bowel-like configuration, but it's not bowel. We've already identified bowel along its entire length. And so this is an irregular fluid collection with a small amount of air, and that's another abscess cavity. Here we have an abscess cavity that is impressing upon the transverse colon, but this is an abscess cavity here. Here's another one that's anterior to the liver. So numerous abscess cavities with free intraperitoneal air evident beneath the hemidiaphragm, and we see a little bit on the left side, but it's a little bit more conspicuous here on the right. So a rather dramatic case of a patient with a complication following cesarean section and who developed numerous collections of fluid and air consistent with intraperitoneal abscesses. And now just to quickly go through the anatomy, here we have the liver with the gallbladder right here. Left lobe of the liver is here. Right lobe of the liver is here. Here's the pancreas, pancreatic head. There's the common bile duct coming through the head of the pancreas going toward the duodenum. Pancreatic head, neck, body, and the tail going off right to the splenic hilum. And we can see the splenic vein immediately posterior to the pancreas. Both kidneys look okay. Here's the left adrenal gland. Here's the right adrenal gland. They both look normal. So liver, spleen, and pancreas, gallbladder, adrenal glands, and kidneys appear normal. The abdominal aorta appears unremarkable. The visualized lung bases appear unremarkable as well. And that's about it. So, in summary, status post C-section with numerous intra-abdominal and pelvic abscesses.